Hello, this is Dr. Ruby and welcome to the second lecture for Module 4, How Muscles Function, the Big Picture. The focus of this chapter is exploring on how muscles concentrically contract. A thorough understanding of this material empowers therapists and trainers to think critically through assessment and treatment options for their client. Here are the objectives for this lesson. Remember that if you come across a term that you don't understand, look it up in your book, look it up online. One of the biggest problems when you take a quiz is that you see a word and you don't understand it. So if you find a word during your reading or during the lecture that you don't understand, just go look it up. Make sure that you understand its meaning, then you can at least understand the question when you come to the quiz. Again, use these objectives to give you a goal or an idea of what we're looking for you to get out of this lesson and be successful on the quiz. More objectives. You can see that this is an important chapter. And one more. Muscles generally attach using their tendons from one bone across a joint to another bone. When a muscle contracts, it creates a pulling force on its attachments. This pulling force attempts to pull the two bones toward each other, shortening the muscle toward its center. If the muscle is successful in shortening toward its center, then one or more of the muscle's attachments has to move. And if the muscle moves a bone, then because the bony attachment of the muscle located within the body parts, the body part in which the bone is located moves. That is how muscles are able to cause parts of the body to move. It is easy to be misled by the word contraction. The word contraction generally means that the action of shortening, but in kinesiology, shortening the muscle is only one of three possible outcomes of a muscle contraction. The three types of muscle contraction are concentric contraction, in which the muscle shortens when it contracts, eccentric contraction, in which the muscle lengthens when it contracts, and isometric contraction, in which the length of the muscle remains the same when it contracts. Every time a muscle contracts, it attempts to shorten. However, it does not always succeed. Muscles that succeed in concentrically contracting are called movers. Whether or not a muscle is successful in shortening toward its center, concentrically contracting, depends on the relative strengths of the pulling force exerted by the muscle and the force necessary to actually move one or both of the body parts to which the muscle is attached. If the force exerted by the muscle is greater than or equal to the force necessary to move the body part, then the muscle will concentrically contract. Generally, the force necessary to move a body part is equal to the weight of the body part, but other forces may also be involved. Let's label one of the muscle's attachments bone A and the muscle's other attachment bone B. If a muscle successfully shortens when it contracts, three possible scenarios can result. In scenario 1, bone A is pulled toward bone B. In scenario 2, bone B is pulled toward bone A. In scenario 3, both bone A and bone B are pulled toward each other. A muscle attachment that moves is called a mobile attachment, and a muscle attachment that does not move is called a fixed attachment. When a muscle concentrically contracts, it causes motion to take place at a joint. To fully describe the action that takes place at the joint, three pieces of information must be provided: the type of motion that occurred at the joint, the name of the body part that moved, and the name of the joint where the motion took place. An action is considered a reverse action if the attachment that is usually fixed is mobile and the attachment that is usually mobile is fixed. The illustrations on this slide show an example of a reverse action. The muscle shown here is the right brachialis muscle. In the illustration on the left, the right brachialis muscle is shown at rest. It attaches to the humerus of the arm and the ulna of the forearm, and it crosses the elbow joint. In the illustration on the right, the brachialis is performing flexion of the arm at the elbow joint. The forearm is fixed, holding onto the fixed bar, and the arm is mobile. Usually the arm is fixed and the forearm is mobile. Therefore, this is a reverse action. In order to make the three possible scenarios for concentric contraction more concrete, we will now examine a particular muscle, the brachialis, in detail. Scenario 1. The usual result of a contraction of the brachialis is shown here. Scenario 1 involves flexion of the forearm at the elbow joint. This means that the forearm is pulled toward the arm. This happens because the forearm is lighter than the arm, so the forearm is likely to move before the arm is. In this scenario, the arm is the fixed attachment and the forearm is the mobile attachment. Scenario 2 is shown here. Scenario 2 involves flexion of the arm at the elbow joint. This means that the arm is pulled toward the forearm. This is an example of a reverse action, as explained earlier. This reverse action occurs when the forearm is fixed in place so that the arm has to move instead. In this scenario, the forearm is the fixed attachment and the arm is the mobile attachment. Scenario 3 is shown here. Scenario 3 involves two actions taking place simultaneously: flexion of the forearm at the elbow joint and flexion of the arm at the elbow joint. These two actions can occur because contraction of the brachialis exerts a pulling force on both the forearm and the arm. In this scenario, neither attachment is the fixed and both attachments are mobile. It is important to recognize that the brachialis muscle is not able to choose which of its attachments to move when a muscle contracts. It merely exerts a pulling force toward its center. Other factors determine which attachment of a muscle will move when the muscle concentrically contracts. The most common factor that influences which attachment will move is the relative weight of the body parts. Another common factor is the use of the fixator or stabilizer muscles by the central nervous system. Fixator muscles stop or fix one of the attachments of a mover muscle. There's a 5-step approach to learning muscles. Step 1, examine the name of the muscle. Step 2, learn the location of the muscle. Step 3, figure out the actions of the muscle. Step 4, learn the muscle's specific attachments. Step 5, determine the muscle's relationship to the other parts of the body. The two major aspects of a muscle that generally must be learned are the attachments of the muscle and the action of the muscle. The muscle's attachments generally have been memorized, but the actions of the muscle can be deduced using three of the 5-step method. The 5-step method for learning muscles is outlined on this slide. The name of the muscle can often provide free information about the muscle's location, attachments, and/or actions. The general location of the muscle can be used to figure out the actions of the muscle. Determining the muscle's location relative to other muscles and soft tissue structures can also be helpful. The actions of the muscle can be deduced by first determining the direction of the muscle's fibers relative to the joint that it crosses, and then deducing from that information the line of pull the muscle has relative to the joint. The recommended approach for reasoning out the actions of a muscle is to ask the 3 questions listed here. Where refers to the relative locations such as anterior, posterior, or medial. How refers to whether the fibers are vertical or horizontal. If a muscle crosses a joint, then it can have an action at that joint. In general, it is also true that if a muscle does not cross a joint, then it cannot have an action at that joint. One method of learning the actions of a muscle is to place a large colorful rubber band or a large color of string, if studying muscles that are near to the face, on the body in the location of the muscle that is being studied. The steps involved in the rubber band exercise are listed on this slide. Placing the rubber band on the body can be used to simulate the direction of a muscle's fibers relative to the joint that it crosses. Pulling either end of the rubber band toward the center stimulates the line of pull of the muscle relative to the joint that it crosses. The movements that result demonstrate the actions that the muscles would have. These are the objectives for section 11.2. Because the line of pull of a muscle relative to the joint it crosses determines the actions that it has, it is important to fully understand the line or lines of pull of a muscle. For each line of pull that a muscle has within a cardinal plane, the muscle will have an action, plus the reverse action of that action. The three possible scenarios for a one-joint muscle and its line or lines of pull are listed here. For every scenario that is listed here, detailing a line of pull of a muscle and the muscle's resultant action, the reverse action of the muscle has not been considered. Because a reverse action is always theoretically possible for every named usual action of a muscle, the complementary reverse action always exists. If a muscle has one line of pull and that line of pull lies perfectly within the cardinal plane, then that muscle will have one action, one usual action, and its reverse action. An example of scenario 1 is the brachialis shown here. The brachialis crosses the elbow joint anteriorly with the vertical directions to its fibers. All of its fibers essentially run parallel to each other and are oriented in the sagittal plane. Therefore, the brachialis has one action, namely flexion of the forearm at the elbow joint. The reverse action is flexion of the arm at the elbow joint. If a muscle has one line of pull, but that line of pull lies within an oblique plane, then that muscle will create movement in that oblique plane. However, this movement has to be broken up into names for cardinal plane actions. An example of this is the coracobrachialis shown here. The coracobrachialis has a line of pull that is in an oblique plane that is a combination of sagittal and frontal cardinal planes. Therefore, the coracobrachialis performs flexion in the sagittal plane and adduction in the frontal plane. If a muscle has more than one line of pull, then for each line of pull that is perfectly oriented in a cardinal plane, one action, one usual action, and its reverse action will be possible. An example of this scenario is the gluteus medius shown on this slide. The gluteus medius has posterior fibers, middle fibers, and anterior fibers, each with a different line of pull on the femur at the hip joint. The posterior fibers pull in an oblique plane and produce a combination of extension in the sagittal plane and abduction in the frontal plane and lateral rotation in the transverse plane. The middle fibers are oriented perfectly in the frontal plane and produce abduction in the frontal plane. The anterior fibers pull in an oblique plane and produce a combination of flexion in the sagittal plane, abduction in the frontal plane, and medial rotation in the transverse plane. If a muscle crosses more than one joint, it is a multi-joint muscle. To determine the lines of pull and actions of a multi-joint muscle, the one-joint reasoning is applied, one joint at a time, to each joint that the multi-joint muscle crosses. Two examples of multi-joint muscles shown are the rectus femoris and the flexor carpi ulnaris. The rectus femoris crosses the knee and hip joints with one line of pull in a sagittal plane. The flexor carpi ulnaris crosses the elbow joint with one line of pull in the sagittal plane, and it crosses the wrist joint with one line of pull in an oblique plane. A muscle cannot choose which of its actions will occur. Muscles are basically machines that contract when they are ordered to do so by the nervous system. If a muscle contracts, then whichever motor units are ordered to contract have every muscle fiber within them contract and attempt to shorten. When a muscle has only one line of pull, it must attempt to create every action that would occur from that one line of pull. If the muscle has more than one line of pull, then the central nervous system can direct motor units that lie only within the line of pull of the muscle to contract. Examples of muscles with more than one line of pull are listed here: the trapezius, the deltoid, and the gluteus medius. Instead of looking at each muscle individually and going through all the questions in step 3 of the 5-step approach for each muscle, it can be more efficient to look at the broad functional groups of muscles at each joint. The functional group approach focuses on joint actions and evaluates what factor a muscle must have to cause a joint action. A muscle belongs to a functional group if it shares the same function as the other members of the functional group. In this section, a functional group refers to a functional mover group. all the muscles in a group that create the same joint action when they concentrically contract. All muscles that have a specific factor or factors that is necessary to create a particular action are considered to be part of the same functional mover group. For example, the brachialis flexes the forearm at the elbow joint, and it crosses the elbow joint anteriorly with a vertical direction to its fibers. The functional group approach points out that all muscles that cross the elbow joint anteriorly with a vertical direction to their fibers flex the forearm at the elbow joint. At each joint of the human body, look for functional groups of movers. In the case of the elbow joint, because it is a pure hinge, a uniaxial joint, it is very simple. Only two functional mover groups exist: anterior muscles that flex and posterior muscles that extend. The muscles of a functional mover group are grouped together because they all share the same joint action. If their joint action is the same, then their line of pull relative to that joint must be the same. This means that a functional group can also be considered a structural group. This means that certain general guidelines can be used to determine where functional groups are located. These guidelines are based on the type of cardinal plane in which the muscle crosses the joint. It should be noted that the location of a functional group that causes a transverse plane action, a rotation action, is harder to determine because muscles that rotate a body part one particular way can be located at different places relative to the joint. Generally, all groups of muscles that cross a joint in a sagittal plane can either do flexion or extension. If a muscle crosses a joint anteriorly, it does flexion, except for the knee joint and joints that are further distal. If a muscle crosses a joint posteriorly, they do extension, except for the knee joint and the joints that are further distal. Generally, all groups of muscles that cross a joint in the frontal plane can either do right lateral flexion, left lateral flexion, or abduction, adduction. If the body part being moved is uniaxial, then the muscles do lateral flexion to the same side. Muscles on the left side of the body do left lateral flexion. If the body part being moved is an appendicular body part, then the muscles do abduction if they cross on the lateral side of the joint, and the muscles do adduction if they cross on the medial side of the joint. Functional groups of the transverse plane do rotation. An easy method to determine the transverse plane rotation action of a muscle is to look at the manner in which the muscle wraps around the body part to which it attaches. When trying to see the manner in which a muscle wraps, it is usually best to view the muscle from a superior perspective as shown here. If the body part being moved is an axial body part, then the muscles do right rotation or left rotation. If the body part being moved is an appendicular body part, then the muscles do lateral rotation or medial rotation. Here are the objectives for Lesson 11.3. The off-axis attachment method is another method that can be used to determine the rotation actions of a muscle. This method involves first visualizing the long axis of the bone and then visualizing whether the muscle attachment is on the long axis or off the long axis. The illustration on the right shows an oblique view of a hypothetical muscle that attaches onto the mobile bone on axis. On axis means that the muscle attaches directly over the long axis of the mobile bone. When this muscle contracts, even though the mobile bone will be moved toward the fixed bone, no rotation of the mobile bone will occur because the muscle attaches on axis. The two illustrations on the right show oblique views of hypothetical muscles that attach onto the mobile bone off axis. Off axis means that the muscle does not attach directly over the long axis of the mobile bone. The two muscles shown in C and D attach off axis on opposite sides of the long axis from each other. so they produce opposite rotation actions. When each of these muscles contracts and shortens, it moves the mobile bone toward the fixed bone, and it rotates the mobile bone in the direction indicated by the red arrow. The long axis is the axis of a bone that needs to be visualized in order to determine the rotation actions of a muscle that is attached to that bone. The long axis of a bone is a straight line that runs from the center of the joint on one end of the bone to the center of the joint at the other end of the bone. The long axis usually runs through the shaft of the bone itself, as shown on the previous two slides. However, depending on the shape of the bone, it might not. For example, as shown on this slide, the long axis of the femur lies outside the shaft of the femur. In general, if a muscle does not cross a joint, then it cannot have an action at that joint. However, sometimes the force of a muscle's contraction can be transferred to a joint that the muscle does not cross. The force of a muscle's contraction is usually transferred to another joint when the distal end of an extremity is fixed and does not allow for free motion of the distal body part to move. This means that when the distal attachment of the contracting muscle moves, it forces motion to occur at another joint. Its force is transferred to another joint that it does not cross. An example of the force of a muscle's contraction being transferred to a joint that the muscle does not cross is shown here. This slide shows the lateral rotation of the arm at the shoulder joint with the distal end of the upper extremity fixed. The image on the left shows a person whose shoulder joint is medially rotated and the forearm is supinated. The image on the right shows the person contracting the lateral rotator musculature of the shoulder, the infraspinatus. When this occurs, the humerus laterally rotates and the shoulder joint relatives at the shoulder joint relative to the scapula. Because the elbow joint does not allow rotation, the ulna moves along with the humerus and rotates laterally relative to the fixed radius. This motion creates pronation at the radial ulnar joint. Another example of the force of a muscle's contraction being transferred to a joint that the muscle doesn't cross is shown here. This slide shows the contraction of the shoulder adductor muscles with the distal end of the upper extremity fixed. In this scenario, movement of the humerus is transferred across the elbow joint to create extension of the forearm at the elbow joint. A muscle's action at a joint can change as the position of the bones of the joint changes. The action of a muscle is based on its line of pull relative to the joint that it crosses. If the position of that joint changes, then the relationship of the line of pull of the muscle relative to the joint might also change. This could result in a change in the action of the muscle. The fact that a muscle's action can change based on the position of the bones of the joint implies that even if an action is listed for a muscle, that it does not mean that the muscle can create that action throughout the entire range of motion of the joint. One example of a muscle that exhibits this phenomenon is the clavicular head of the pectoralis major. This slide shows the orientation of the fibers of this muscle relative to the shoulder joint when the shoulder joint is in two different positions. The clavicular head of the pectoralis major is considered to be an adductor of the arm at the shoulder joint because the muscle's line of pull is from lateral to medial below the center of the shoulder joint. However, if the arm is abducted to approximately 100 degrees or more, the orientation of this muscle relative to the shoulder joint changes from being below the center of the joint to being above the center of the joint. That means that this muscle can abduct the arm at the shoulder joint when it's in this position. Another example of a muscle that exhibits this phenomenon is the adductor longus. The adductor longus is considered to be a flexor in addition to being an adductor of the thigh at the hip joint because it passes anteriorly to the hip joint with a vertical direction to its fibers. However, when the thigh is first flexed to approximately 60 degrees or more, the line of pull of the adductor longus lies posterior to the hip joint, and the adductor longus becomes an extensor of the thigh at the hip joint. This change in action is very useful while running because when a person is in a position of extension, the adductor longus aids in flexing the thigh at the hip joint. And when a person is in a position of flexion, the adductor longus aids in extending the thigh at the hip joint. This concludes the lectures for Module 4.